And coming up on National Report, there's a battleground, reportedly high rate of suicide among U.S. military veterans. We'll talk to one doctor who's also a U.S. veteran about what's being done to help soldiers at risk.
There's a reportedly high rate of suicide among U.S. military veterans. We'll show you this. The number of veteran suicides exceeded 6,000 each year from 2008 to 2017. This is according to the most recent report published by the U.S. Department of Veterans Affairs.
In response, the VA started universal screening for suicide risk a couple of years ago. Since then, more than 3.8 million veterans have been screened for suicide. Joining us now is U.S. Navy and Army veteran Dr. Rick Boone. He's Warrior's Heart Clinical Director and Clinical Psychologist. Doctor, thanks so much for being with us this morning. Obviously, a very serious topic. Do you think that we've discussed this enough? Is this, well known among the media as to how serious of a problem this is?
First of all, thank you for having me on your program, and I'm grateful to be able to talk about this important issue. I think that media coverage has been appropriate and serious-minded. But we're talking about America's heroes here, the warrior class. And so in some sense, as long as it remains a problem, there's never too much that can be said about it. And certainly here at Warrior's Heart, we're trying our very best to do something about it, to make a difference in some of those disturbing rates you mentioned.
Military suicides, I'm curious because I want to put this into perspective. Are we talking about while they're in service? Are we talking about after they get out of the military? When is this happening?
This is, well, the epidemic, if you will, is across the board. It's during active duty, and it's certainly true for our veterans.
So it's during active duty and as well as when they get out of the service. So then where are we missing the mark here? What are we missing here? What do we need to be doing to change this?
Well, I think, of course, something has to happen in the military itself. And I know that they're working hard to produce effective suicide prevention programs. What we're doing at Warrior's Heart, of course, is both active duty and veterans. And what we're really about is the installation of hope. Of course, suicide is an action that takes place when people have given up, when they feel like death is preferable to a continuation of whatever kind of disturbance they're having. So part of our program is, a very important part of it, is simply the installation of hope, giving these men and women an opportunity not just to get sober or to address their trauma. And of course, as you all know, trauma is at the foundation of much of our substance use disorder problems in the warrior class. But it's to provide them with an opportunity for a great life. That's what they need. They need to reconnect. These are men and women who had a great life, who are doing amazing things that most of us would not dare to try to do. And yet they fell upon these very difficult times, either through physical injury or repeated multiple deployments, which of course has the effect of sort of disconnecting you from your family and social support. Many of them find themselves adrift in physical pain, psychological pain. So we're trying our best to give them a reconnection with that great life they once had.
What are some of the signs that people might be able to look for, either family of friends of veterans who've served?
Very good question. Excellent question. I think perhaps one of the most important things is a sense of estrangement or isolation, disconnecting yourself from the people you once loved. And if you're a family member, a spouse, a young adult child, a parent, and you notice that, that I think is a key sign that something is amiss.
If there are veterans out there, if there's folks in the military right now that are watching this broadcast, what are programs out there that can help them if they find themselves in a situation unfortunate as this?
Well, I would like to say that there were lots of programs, and of course there are many substance use disorder clinics that will have tracks for veterans and first responders. Regrettably, in one sense, Warrior's Heart is quite unique. It's the only private residential treatment facility exclusively for our Warrior class. So what we're doing is unique. I'd like to think that we're trying some new approaches, more holistic. We like to say that it's the mind, body, spirit that's being treated here, not just the addiction or not just the trauma. It's a human being. But I think other people are beginning to get that message, and I'm hopeful that others will join us in this cause.
It's great to see, your organization doing so much. Can you tell us what the response has been like for veterans who've come in to your clinic and used your services to get better?
Well, thanks for asking that. We like to welcome people home. This is a home for them. It's a beautiful environment. That's one thing. So the response to the environment alone is generally positive. We also have what I would consider a multiple therapeutic tracks, not just psychotherapy, which we have plenty of, and not just chemical dependency treatment, which we have a lot of. We're very much a 12-step program. This is the very best program for chemical dependency, but we have lots of other things. I mean, people come here and they get to live a full life. Art therapy, canine therapy, CrossFit. Again, it's a body, mind, spirit treatment facility.
All right, Doctor, I appreciate your time and sharing this knowledge with us. That's Dr. Rick Boone, Warrior's Heart Clinical Director and Clinical Psychologist. Thank you very much. Coming up on National Report.